Dear friends from media, good afternoon. Welcome to the press release of the Joint Prevention and Control Mechanism of the State Council. And right now, the pandemic is still raging across the world, and the Delta variant is the major variant that is popular around the world. And in recent weeks, there has been some imported cases, and we have infections in Fujian that has been basically well contained. We need to consolidate this victory. And in Heilongjiang, we're having some hard times, and we will have to continue with our efforts against COVID-19 so as to contain the spread of the disease. We are going to have the National Day holiday, and there is increasing risks. And also, we are entering autumn, so we cannot slacken our efforts, and different localities must continue to do a good job in fighting against imported cases and also domestic swipe of the cases. In particular, we have to continue to do a good job in monitoring and also early warning. Whenever we encounter a new case, we need to take some immediate actions, and we also need to make continuous progress in vaccination. As of September 28, China has administered more than 2.2 billion doses for COVID-19. A total of more than 1.4 billion people have completed all the doses of vaccination. So today's press release is on continuous measures against COVID-19 and also vaccination program. And we have with us Deputy Minister Han Jianhua from the Ministry of Transport. We have also Level 1 Council Hou Zhengang from the Ministry of Culture and Tourism, and also Level 2 Council Mr. Cui Gang from the National Health Commission, and also Director General of Shanghai Health Commission, Mr. Wu Jinglong, and also Chief Experts Wang Huaqing from China Center of Disease Control and Prevention, and they will be available for your questions. And now we are going to start the Q&A session, and before raising a question, please also identify yourself. First question, please. Thank you. I'm with CMG. In Fujian and Heilongjiang, there is a resurgence of cases, and this has drawn the attention of the people across the country. And what is the general situation of COVID-19 in China? And what further measures do we have against the situation? Thank you very much for your question. In recent weeks, in Fujian and Heilongjiang, there are some cluster infections. As of 24 o'clock on September 28, in Fujian, we have reported a total of 470 confirmed cases and asymptomatic cases. In Heilongjiang, there are 75 such cases. And since the outbreak of the cluster infection, the CDC of the country, as well as the National Health Commission, immediately kicked off a response measure, and we dispatched teams to these two localities to guide their COVID-19 measures. And currently, all those measures are well underway. In Fujian and in Heilongjiang province, and also some municipalities and counties, there have been a number of press releases telling the public the latest about the COVID-19 and also the relevant progress made. As Mr. Mi Feng has mentioned earlier, in Fujian, we have basically contained the coronavirus pandemic in Zhangzhou City, Quanzhou, and Putian. In recent days, there has been no new cases reported. In Xiamen City, the cases are going down. In the province of Heilongjiang, we are right now at a crucial moment, and we are right now strengthening our efforts against COVID-19. So since China has entered into a stage of routine prevention and control against COVID-19, in particular, since July, and there has been some cluster infections caused by the Delta variant. And because of this, Delta variant is very transmittable and it's very quick in spreading. So to do a good job in containing the virus, we need to put in place very effective measures and make sure that these measures can be very effective against those viruses. And we need to take immediate actions and also strengthen isolation on those with close contact history and also do a better job in community-level prevention and control. Our purpose is to effectively contain the outbreak very quickly so that we can recover the normal social and economic order. Next question, please. Thank you very much. I'm with China Transport News. So the pandemic is still there, and during the National Day holiday, there will be a spike in passenger flow. So what measures do we have in place against this potential danger? Thank you very much. The Ministry of Transport attaches great importance in epidemic prevention and control in upcoming holiday. We are going to focus on our monitoring, and we will focus on the following 4 areas of efforts. Number 1, contain the cases imported from overseas. And this means that we're going to do a good job in customs clearance and also international travels for drivers, pilots, porters working at the international airports, and also frontline posts. We are going to put in place closed-loop management, and we're going to intensify NAT campaigns. And also, number 2, we need to do a good job against domestic spike of the cases. Operators in city transportation and passenger transportation need to do a good job in disinfection and ventilation in transportation hubs. Passengers need to have their temperature taken. They need to wear masks. And people working on important posts, they need to take the NAT very frequently and also do a good job in epidemic prevention and control. And number 3, we need to do a very good prevention job. And before the holiday, we have dispatched inspection teams to different localities. Through investigation and inspection, we have extended the pressure to different localities. So whenever we find a problem, we're going to rectify the issue so that we can close the loopholes. In the meantime, we are building a regular mechanism for video monitoring, and we press the different localities to put on the ground different prevention measures. Number 4, we help different localities to improve their mechanisms, and during the National Day holiday, we are going to set up a task force, and that will be working 24/7. We will watch closely the situation of the pandemic, and whenever there is a new case, we will provide guidance to local transport authorities so that they can very effectively ensure the normal order of transportation and also contain the danger of epidemic. I would also like to remind all the passengers to comply with the transportation rules and also maintain social distancing, and let's work together for a safe holiday. Next question, please. Thank you very much. I'm with Phoenix News. Some organizations predicted that there will be a spike of the number of passengers, and already we have cluster infections in 2 provinces. So what further measures do you have against this potential danger? Thank you very much for your question. As you have mentioned, this year, during the National Day holiday, we're going to have a overlapping effect of three factors. First, because of the impact from July and August, a lot of the citizens, they have a desire to travel to different places for travel. Secondly, some localities have released incentive measures for tourism. And third, it's very good weather, and so people tend to travel in this upcoming holiday. So this will trigger an increase of the number of travelers. But tourism is a sector that features great flow of people and also a great gathering of big population. So the Ministry of Culture and Tourism attaches great importance to this phenomenon. We are going to follow through the requirements of the CPC Central Committee and the State Council, as well as its joint prevention and control mechanism. So COVID-19 prevention is our priority, and we will mainly take two measures. Number one, we will judge the situation in a general manner and do a good job in prevention. In mid-September, the Ministry of Culture and Tourism circulated a notice on improving prevention against COVID-19 in the upcoming holiday. The Ministry of Culture and Tourism in mid-September also circulated a notice on fighting COVID-19 in the Mid-Autumn Day as well as the National Day holiday. So these two notices have laid out explicit requirements on COVID-19 prevention, and this morning, our ministry convened a TV conference nationwide, which laid out further guidances for COVID-19 prevention in the tourism sector. Specifically, we are going to put in place advanced reservation for tourist sites, and travelers need to scan their QR code and also have their temperatures taken. And number two, COVID-19 measures must be put in place at different tourist spots. We need to contain the overall skill of travel teams in such links of hotel accommodation and sightseeing tours and restaurants. COVID-19 measures must be put in place. And we need to constantly give reminders to travelers, and also public libraries, theaters, internet cafes, entertainment centers, and also culture and tourism organizations must continue focus on COVID-19 prevention. And we need to ensure ventilation and disinfection at public places, and also bring in place a circuit-breaking mechanism for cross-border, cross-province travels in case there is a reported case. And number five, travel agencies and online travel operators, they will be suspended of their international travel businesses. On the other hand, the Ministry of Culture and Tourism will continue to do a better publicity job so that we can remind the public to pay close attention to COVID-19 prevention and control. And COVID-19 prevention is a precondition for safe holiday and also for safe travels. Through our portal websites, official websites, and also news releases of this kind, we constantly publish information about COVID-19 prevention during travels so that we can raise the public awareness in COVID-19 prevention. And secondly, we guide different cultural and tourism organizations to do a good job in COVID-19 prevention, and we display promo videos on COVID-19 prevention, and we guide the public to take the initiative to observe COVID-19 rules. Today, taking this opportunity, I'd like to once again remind travelers across the country to pay close attention to the situation in medium and high-risk areas, refrain from traveling into those areas, and when you are traveling, you need to take the initiative to cooperate in scanning the QR code, in wearing a mask, wash your hands often, ensure ventilation, maintain social distancing, and when you have symptoms of fever or dry cough, you need to immediately go to a hospital. Next question, please. Thank you. I'm with the Xinhua News Agency. So according to the reports, some provinces are considering a booster shot. So why is there a necessity for a booster shot for key groups of population? Thank you very much for your question. And this is a question about the booster shot. And let me answer this question from the following perspectives. Number one, globally, the total number of doses administered has exceeded 6 billion. In China, we have exceeded 2 billion. If you look at the whole world, the vaccines have played an important role. In China, we have conducted relevant researches, and several weeks ago, there was this cluster infection in Guangdong, and there is this Delta variant. We conducted some researches, and we found out that the efficacy rate of vaccination has reached 90%. And vaccines played an important role in avoiding the disease from deteriorating into a severe case, and it has also decreased the number of hospitalization. But we have also noticed the fact that the protection of the vaccines is going down, and we have organized a number of experts. We have conducted some researches and investigations, and we are told by those research organizations that there is a need to put in place an additional dose, and we found out that an additional dose will pose no health risks, and it can very effectively guard against potential spike of cases. And also after the booster dose is administered within half a year, there can be a decrease of the cases reported. So all the researches are showing that there is very good results if we take a booster shot. There are researches at different levels, and all the researchers have shown that a booster shot, a booster dose will increase the level of protection. So based on all those researches, and we are seriously considering of administering a third dose on those key groups of population. And this means those people who work at the international ports and airports, designated hospitals, and also people who might have a larger chance of exposing themselves to the COVID-19 disease. And also relevant researches have shown that after taking a dose, the immunity can be significantly enhanced, and people above the age of 60 and 65 can also dramatically increase their immunity after taking a dose. According to the suggestions by experts, if you are traveling to a country with a huge number of cases, and then it is necessary that you take that dose. So this is only an advice, and right now we are just considering a booster dose for key groups of population, as for whether this program will cover the overall population of the country, and we are still deliberating on a program, and we will conduct comprehensive researches going forward. Next question, please. I'm with Health Newspaper, and my question is to the Director General of Shanghai Health Commission. We have noticed that whenever there is a case in Shanghai, the Shanghai authority is able to very quickly organize a press release, and it can very quickly indicate the case on the personal travel history database. How did you manage to do such a good job? Thank you very much for following the situation in Shanghai, and from what we can observe, speed is very important when it comes to epidemic prevention and control. In Shanghai, we have in place a very flat control and command system. In Shanghai, you know that we have witnessed several different rounds of epidemics. And whenever there is an epidemic, we have cadres and government officials at the top level that can be quickly dispatched to different localities, and we have a system that is very flat. So it's not hierarchical, and it's very flat, and this is very important. And also, since last year, at the district level and the municipal level, we have a prevention office, and they are working together, and they are in a joint mechanism, so there is no barrier between the district level and also the municipal level. And this system ensures that we can put in place very effective and very immediate actions. So from our experience, we can share with you 2 points of takeaways. Number one, at the very beginning, we have defined the procedures and standards of epidemic prevention and control. We have formulated the standards in Shanghai for COVID-19 prevention, and we focus on process management, which covers early warning, treatment, and summary. So at the early warning stage, and we have to feature early reporting and early warning, and also you need to put in place very good response. That has to be very speedy, and you need to conduct very scientific epidemiological surveys. And also at the third level, which is real and substantial actions, and you need to take real measures against the COVID-19. And very importantly, you need to have this coordination between different departments. And different departments, they have to shoulder up their responsibilities, and they need to conduct their efforts in a coherent manner. From our experience, we believe it's very important to put on the ground very effective and very scientific measures. We have always emphasized the importance of district municipal joint response. So each time when there is the case, this mechanism will be activated, different task forces and different teams, and they will be able to quickly arrive at the sites, and also at the district level and also the municipal level, there is a joint command center under which we have many different teams, for example, isolation team, epidemiological survey team, and also early reporting team. So we push the control measures to the very front. In Shanghai, at the municipal level, those experts team, they can also arrive at the site, so they can provide some technical support when they arrive at the different sites. So in this process, the Health Commission, the Public Security, Telecommunications team, and also Big Data team, and the news and publicity sector, there is a high level of coordination and collaboration. And in this process, we have to guarantee that the patients are treated, the samples are collected, and the sites are disinfected, and also the community is put into very effective management. So we have to rely on the efforts of each other to do all this. And we believe the first hour is very important. So we believe there is this golden 24-hour at the very beginning. So we never delay or postpone the work to the next day, and we publicize the information immediately to the public. In this process, whenever we identify a suspect case, we simultaneously engage in 4 different efforts. Number 1, we're going to kick off the epidemiological survey efforts. So we're going to track the contact and those who have a contact with the suspected case. And also in this process, we must also put in place the transfer, isolation, the NAT, and also community measures at the place where the person comes from. So we have to identify a person with the close contacts and also those with contact with that person. And number 3, we must also quickly kick off the nucleic acid testing. And you can see, and that is why we have at those press releases the exact number of NAT. And the 4th step is to analyze the key concerns of the public. So we analyze the concerns and sentiments of the public about the COVID-19. So that is why at those press releases we can very effectively respond to the concerns of the public while reporting very specific data. So this will help stabilize the expectations of the public, and this will well address their concerns, and so they will follow the situation in a very scientific and reasonable manner. So that is why we always attach great importance to speed. Thank you very much. I'm with Oriental TV. In Shanghai, there has been more than 2,200 imported cases, and this is ranking first amongst all the localities in China. So there is a very strong pressure from imported cases. So what are the measures Shanghai has against imported cases? Thank you very much. So Shanghai has always had a large number of imported cases. According to my analysis, Shanghai ranks first amongst all the provinces and municipalities in China in this regard. In Shanghai this year, there are 3 rounds of imported cases that are related to airports because Shanghai is a mega city. We have a huge population, and there is a high level of flow within the population, and also Shanghai is relatively a smaller land. And we face another pressure, and that is each and every day we have a lot of inbound flights. In Shanghai, we account 1/3 of all the incoming flights of the country. Also, the cargo flights account for 40 to 50% of the country. This is roughly 1/2 of China's total, and Shanghai is also a port city. We have a lot of containers coming to the city, and the number of containers coming to Shanghai ranks first globally. So we do face a lot of challenges. So in the process of guarding against the imported cases, then we need to put in place prevention control measures against people, goods, as well as environment. Our observation has shown that we need to put in place early identification, early warning, early reporting, and early treatment. We also need to make sure that we can identify the problem very early and very effectively, very quickly, and solve the issue in a cost-effective manner so that we can strike a very effective result. So we need to put in place scientific prevention. And this means scientific analysis and risk warning. From the very beginning up until present, we always attach great importance to scientific prevention. We leverage the technical resources of the experts in Shanghai, so that is why we have set a municipal expert team containing 66 scholars and experts. We regularly hold meetings about COVID-19 prevention. We conduct regular analysis, and we reflect on our own measures, and we constantly improve our mechanism. As I have mentioned earlier, in fighting the pandemic, those experts, they fight on the front line, and they provide very effective technical support so that our COVID-19 measures are very effective, and they are also very targeted. Another very important feature is joint prevention and control, and we have included the parts in our action plan. We put in place a multi-layered prevention and control mechanism, and by that we have strengthened COVID-19 prevention at the international ports and airports. Customs, border control, civil aviation, and maritime authority, those authorities, they are very important, and that is why we work together with them in a very effective manner. And we put in place a full process management over those inbound travelers. And we push the information precisely to relevant authorities, and that is why we can put in place very effective control over inbound travelers. Another very important experience is the joint prevention and control in the Yangtze River Delta area. We want to thank the support from the National Health Commission for giving us great guidance in this area. So if an inbound traveler is traveling to one of the 3 provinces in the Yangtze River Delta, they need to be included in our comprehensive control measure. So after their isolation at the Shanghai International Airport, they will be transferred to a neighboring province in a very safe manner. So here I also want to thank the support from our neighbor provinces and cities in Shanghai. Another very important success experience is the close collaboration between different departments in Shanghai. For example, for inbound traveler management, we have in place this uniform isolation, and we have vehicles and personnel from all the 16 districts, so that these vehicles, they can transfer those inbound travelers to their respective districts. So from the international airports to their respective districts, there is a closed-loop management. And thirdly, we have strengthened management and control at the isolation venues. And for any inbound traveler, you need to subject yourself to a 14-day isolation and also a 7-day home quarantine. Within this process, there are 6 rounds of nucleic acid tests. And when you show some unpleasant results, you will be subject to an additional test. So we ensure that this closed-loop management is put on the ground. And also we put prevention in the first place. In the meantime, we are making progress in vaccine development and research. After witnessing several rounds of infections, we believe vaccination is a very powerful weapon. It can successfully contain the spread of the disease. And as of yesterday, Shanghai has administered 47 million doses. In Shanghai, we have 20.58 million people that have completed all the doses, and this accounts 90.9% of the total population in Shanghai for people above the age of 18, more than 20 million people have taken a dose, and this accounts for 91.8% of all the population above 18. Going forward, we will continue follow with the measures of the National Health Commission, and we will continue to do a better job in vaccination. So these are the work that we have carried out. Thank you. Thank you very much. And with 21st Century Economic News. So in earlier press conferences, the progress of vaccination has been released. So what are the future plans you have regarding administering the booster dose? Thank you very much for your question. And right now, the pandemic is still there in the world. And there is increasing risk for the disease to be transmitted here domestically. And in recent weeks and months, there has been some imported cases which shows that China still faces arduous pressure in fighting against domestic spikes as well as cases imported from overseas. Vaccination is a powerful weapon, and it can reduce the number of severe cases and also those hospitalized. And vaccination is a powerful weapon to dramatically improve the immunity and also reduce the danger of infection. We have already organized experts to engage in a thorough investigation. And just now, my colleague has introduced the recent progress. For example, the deactive virus, as well as its efficacy within the period of 6 months, according to the suggestion of experts. For those who have already taken the vaccines, if you're working at the airport, at the international port, in customs office, at national borders, in designated hospitals, and if you are above the age of 60, and we're considering an additional dose, a booster shot. According to the research of experts and their deliberation, and also based on the needs of COVID-19 prevention and control, we are right now formulating the policies of booster shots and also the measures for administering the booster shots, and we will continue guide different localities to improve their vaccination program. Next question, please. Thank you very much. CMG. So we are entering autumn and winter, and there is increasing pressure of epidemic prevention and control. And how will the Ministry of Transport do a good job in epidemic prevention and control for cold chain imported food? Thank you very much for your question. And cold chain food has been a key area of epidemic control and prevention, and the Ministry of Transport has amended and improved the guidelines on COVID-19 prevention in the cold chain food. Number one, we're going to improve the closed-loop management on high-risk posts. For potters, janitors, and other people who work on high-risk posts, they have to take the vaccines, and they also need to comply with the closed-loop management. They also need to take shifts in epidemic prevention and control, and during the COVID-19 prevention process, they need to live together. We need to put in place uniform management, and we need to minimize their contact with people outside, and also do a better job in safety training. And for those who do cleaning and goods loading and offloading, and they will be given a NAT every 2 days. And for other groups of people, and they will be given an NAT every week. And we also put in place a daily reporting system. Number 3, daily disinfection must be put in place. And those disposable goods, they must be treated in a safe manner, and they must be disposed. And also the containers in their operational venues, they must be also disinfected. And those shuttle buses at the international airports, they must be disinfected very frequently. And also disposables and waste from kitchens and other areas, they must be disposed in a safe manner. And we also press those cold chain food enterprises to come up with quarantine and inspection certificates. And they need to properly register the information of porters and janitors and loaders. If they cannot provide the certificate of their importers, and they will not be allowed to be in this country. Next question, please.
谢谢发言人。向个京一导报记者提问。旅游安全是全社会都关心的一个问题，请问文化和旅游部将采取哪些措施？
Thank you very much. I'm with the Hong Kong Economic Herald. And travel safety is a very important subject. And what measures does the Ministry of Transport have in ensuring the safety of international travelers during the holiday? Thank you very much for your question. As you have mentioned, safety is the bottom line of travel. Without safety, there is no health. Travel-related safety is very important, and this is just as important as epidemic prevention and control. And those are the bottom lines that we hold firmly at the Ministry of Transport. Specifically, we need to focus on 3 areas: on enterprise level, on authority level, and also on travel operator level. For enterprises, they need to shoulder their responsibilities. Travel agencies and international travel operators, and they need to conduct safety analysis over their tourism routes. If they outsource the operation to a third party, and they need to check the qualifications of the service providers. And the tour guide, they also need to offer guidelines and reminders. And also when we travel, we need to remind our passengers to fasten their seatbelt. And tourist sites need to do a good job in fire control. In particular, those wild spots of tourist attractions, they need to very strictly guard against the fire. And they also need to closely monitor their cable cars and different facilities. And star hotels, they need to do a good job in food safety management, fire facilities, and gas facilities, emergency exits, and safety pathways must be put under very strict safety management. We also need to strengthen interdepartmental collaboration, and tourism is a very lengthy industrial chain, and it involves restaurants, hotels, as well as transportation. So that is why we are working closely together with the Ministry of Public Security, Health Commission, as well as the Ministry of Culture and Tourism. So we will strengthen regulation and safety inspection, And whenever we identify some illegal behaviors, we need to make sure that they can be punished immediately so that we can guarantee the interest and safety of travelers. And also at the travelers level, we need to give them reminders and guidances. When I was answering a previous question, I touched upon COVID-19 prevention and control, and I said we need to give guidelines and instructions to our travelers, and the same goes to safety through websites, through new media, through bulletin boards, and also the LED screens at tourist attractions. We have to raise the awareness of safety amongst the travelers, and let me give you some examples. For example, we request that travelers do not enter in forbidden areas in tourist attractions that are not open to the public. And they also need to follow the laws and observe the rules, and I hope that all the travelers can raise their awareness of safety. Taking this opportunity, I'd like to call on all the travelers to develop civilized behaviors. And when you are traveling, you must take the initiative to observe the code of conduct and also engage in civilized behaviors. Graffiti is strictly forbidden. We must also refrain from wasting food when we eat in a restaurant. Thank you. Next question, please. Thank you very much. I'm with Red Star News. Recently, the cases in China are from overseas, and those who are isolated, they are a high-risk group of people. So what control measures do we have over this group of people? Thank you very much. Reality has shown that uniform isolation is an important measure in China to guard against imported cases. Strengthening management at quarantine sites and also standardizing the management in those venues, they have been a key area of our focus in COVID-19 prevention and control. And different localities must continue to do a good job in the following areas. The first is to put in place strict standards, and they need to streamline the sites, interior design and layouts, and also facilities at those isolation sites, and they can only be put into use when they meet the standards. Second, we need to ensure sufficient supply of medical goods. Before the end of October, we issued the standards of 20 per 10,000. And different localities must set up an emergent isolation site featuring qualified facilities and standard management. We need to avoid the situation of distributing very small isolation sites in a very scattered manner. Thirdly, we need to have in place some backup quarantine centers for areas where there are high risks of importing the cases from overseas. They need to put in place a inbound travelers observation and quarantine center based on COVID-19 prevention rules and also the reality of the locality. In some localities, we allow the construction of large quarantine sites. Number 4, we need to put in place standard management, and this includes ventilation, disinfection, waste disposal, and also the collection of medical goods or medical supplies used. For those working at the isolation sites, they must be filed and registered, and they need to live together in one designated building, and they must be trained. They must also maintain a high frequency of nucleic acid test. They also need to protect themselves very well, and we need to ensure that those who have to quarantine must be quarantined. In our analysis, we need to put in place very strict measures in quarantine so that we can protect the safety and health of the public. Next question, please. Thank you very much. I'm with the China Youth Daily. We are soon going to enter the National Day holiday. A lot of us have travel plans. So what precautions we need to take in this upcoming holiday? Thank you for your question. So we're going to start the National Day holiday, and there is a lot of concern on COVID-19 prevention in this upcoming holiday. A lot of us have plans of travel. The massive flow of population will pose a lot of threat to COVID-19 prevention and control. Based on the overall situation in China, we will draw upon the experience and practice in previous months. And when you travel, we remind you to pay close attention to 2 points. Number one, stay on high alert against COVID-19. Minimize those unnecessary travel plans. If you do need to travel, you need to be aware of the COVID-19 situation in your destination and refrain from arriving at medium and high-risk areas. Do a good job of health observation. If you have shown symptoms of dry cough or high fever, you need to immediately cancel your travel plans and also resort to a nearby hospital, to the designated hospital. And if you have experienced such symptoms during travel, you need to immediately go to a nearby hospital. And also, at the centralized quarantine sites, at the international ports, at designated hospitals, and those who work at the high-risk posts, they should refrain from traveling across different regions. Also, we need to protect ourselves very well when we travel. When we take trains or flights, we need to avoid traveling at peak hours of the day and refrain from going to crowded places or public places. We need to closely observe COVID-19 rules, for example, maintaining social distancing, wearing masks, washing our hands often, etc. And when we check in a hotel, we need to ensure ventilation. We need to open the window often. We also need to closely observe the COVID-19 rules in a travel destination. In a case of a COVID-19 situation in the travel destination, we must closely comply with the COVID-19 measures in the travel destination, and we will continue guide different localities to follow through the COVID-19 prevention measures. And we will adopt a question-oriented approach and help different localities to formulate targeted measures. And this will focus on travel agencies, tourist attractions, as well as travelers. And we will do a very good job at different links. In the meantime, we are going to ensure support from a transportation perspective and do an effective job in COVID-19 prevention. And we hope that the travelers can be understanding and can cooperate with the COVID-19 rules, and let's work together and create a harmonious and safe and healthy travel environment. Thank you. Next question, please. Thank you very much. I'm with front cover news. My question is related to the booster shots of vaccine. How long does one have to wait till he is able to take the additional shots? Thank you very much for your question. So you mentioned about the interval between the second and the booster shots, and let me answer the question from the following perspectives. Number one, who can be eligible for the booster shots? As I have introduced, and this will mainly cover the key groups of population, and this includes those who have a high risk of exposing themselves to the disease. For example, those who work at the customs office, the quarantine system, civil aviation, and also who work at designated quarantine sites and designated hospitals. And those people, they need to take a booster shot because they are considered high-risk groups of people. And secondly, those who have dysfunctional immune system and those who are above the age of 65, they are kindly advised to take the booster shots. And also travelers who need to travel into high-risk countries, they are also advised to take the booster shots. And secondly, with respect to the interval between the second and the booster shots, according to the suggestions of experts, you need to wait 6 months before you take the booster shot. For example, if you have taken the inactive vaccine, you need to wait till 6 months later after taking the second dose. And thirdly, with respect to the selection of vaccines, our suggestion is that you take the same vaccine as the first and second dose. If in case the same enterprise or the same brand cannot meet the supply demand, you can take vaccine from other brands as long as they follow the same technical pathway. They are of the same technical pathway. And also, if there is some allergies or side effects after taking the dose, you are not advised to take the booster shots. So there are some precautions, and we hope that all the population can comply with those requirements. And when you are taking the booster shots, you're highly advised to stay at the inoculation site for 30 minutes for health observation. So this is simply to avoid some unpleasant side effects. Last but not least, according to the results of some clinical researches, there are some mild symptoms, for example, fever or headache or ache at different areas of the body, and this is not a severe symptom. Normally, you don't need to go to a hospital, but if you have some very severe symptoms, you are kindly advised to immediately go to a hospital. Next question, please. I'm with People's Daily. So we are going to enter this National Day holiday. What are the features of the passenger flow in the upcoming holiday? Thank you. Thank you very much. So the National Day holiday is a peak season for travel, and there is strong demand of travel from the public. According to estimates, we're going to witness the following features. Number one, in the first day, we may have the peak hour or the peak moment of travel or passenger flow, and then it will gradually mitigate. And the last 2 days of the holiday will feature mainly return trips, Shanghai, Guangzhou, Shenzhen, Chengdu, and some key cities. They will feature a very high passenger flow. And thirdly, in terms of the amount of travel, domestic travel will be the primary form of travel, and for cross-province travel, we will see a lot of those type of travel in South China and southwest and southeastern part of China. So during this holiday, we will ensure our support to the vast number of travelers across the country. And number one, improve our transportation services, and we will organize different localities to improve their plans and improve the capacity at different localities and different sites, and also feature greater coordination between public transportation and civil aviation. Also, we need to avoid the gathering of traveling passengers. We also need to switch from paper form of tickets to electronic tickets. If you're traveling to the countryside to visit your relatives, and bear in mind that we will improve our services, and we will provide car rental services, and also we will improve the service capacity provided for rural travelers. We will also do a better job in safety patrols at city highways and country roads. And whenever we encounter some abnormal situations, we will immediately rectify the situation, and we will also provide guidance services at highways. And this means that we are going to ensure our service in terms of refilling and also parking. And thirdly, we will improve safety services. We will put in place strict measures in safety check. We will hold those illegal behaviors accountable, and also strengthen the collaboration between different departments. We will also do a good job in weather forecasting and reporting. So whenever there is a new situation, we will immediately publicize the information to the public. Next question, please. Thank you very much. I'm with Economic Daily. My question is directed to Director General Mr. Wu from Shanghai. In Shanghai, after those cluster infections, there has been some subsequent cases, but in general, the situation has been maintained very effectively. So what is the success experience that you can draw from Shanghai? You mentioned a very important question. Epidemiological survey is the foundation for our actions against COVID-19. So we have in place a speedy, standard, and effective epidemiological survey mechanism, and this is very important. And this is able to guarantee that we contain the spread of the disease. For a city like Shanghai, with this in place, we can minimize the impact of the COVID-19 to our normal social and economic order. So in terms of the quality of our actions, we have attached great importance to the setup of our epidemiological task force. And we have a task force consisting of 3,000 people, and they are very professional. They are highly trained and well qualified. For subsequent actions, we attach great importance to 3 areas. Number 1, speed. Because when you do epidemiological surveys, you need to be very responsive and very quick. You need to arrive at the site within 2 hours, and within 4 hours, you need to complete the first round of epidemiological surveys, and within 24 hours, you need to understand the situation of the travel history and also the community where the suspected case comes from. Through these efforts, we can ensure that the situation is fully understood. So whenever necessary, we will get to know the travel history of the person, and we will get to know the situation of the community where the person comes from. So this is very important. So speed is of paramount importance. The second is meticulous efforts. So we have to be meticulous in 5 areas. Number one, a division of labor, division of responsibilities, and whenever we have a case, so we don't have a hierarchical management. We have a flat management, and we cover, for example, those who have contact with the case, for example, ride-hailing services. For example, in one of the cases, the person involved 1,000 persons of close contact. So the second is that you need to be very meticulous in understanding those people with close contact with the person and what protective measures they are taking place. And thirdly, you need to meticulously follow the progress of the epidemiological surveys. And as I mentioned that you need to have this 24-hour epidemiological surveys, but in reality, we summarize the situation every 1 hour. So also you need to put in place very meticulous data analysis. So when we kick off the response plans, we focus on tracing the origin of the virus. We focus on the genetic sequencing of the virus and also epidemiological surveys. Also, very importantly, you need to put in place very meticulous control and management measures. So the high-risk people that you have designated must be very accurate, and this will guarantee effective measures going forward. And also, you need to put in place meticulous coordination between different departments. I mentioned that under the command of the Joint Prevention and Control Mechanism, we have close collaboration between the city governments as well as public security, a municipal health commission, and international airports in the city. So with this in place, we can perfectly understand the source of the virus and also trace the close contacts of the person. And this will dramatically improve the quality of the epidemiological surveys. So in this process, as I have mentioned earlier, we have at the municipal level a epidemiological experts group, and they will be dispatched to the site of the newly reported case immediately, and they will help us gather information and formulate measures of prevention and control, and they will also help us define the designated area of COVID-19 control. In addition to what I have just mentioned, in specific work, we designate 3 circles. The first is close contacts. The second circle is the contacts of close contacts. The third circle is the travel history and the places involved by the travel routes of the person. So we have to very quickly put in place COVID-19 prevention measures, focusing on these 3 layers and 3 circles. So in addition to close contact and contact with close contacts, we also need to conduct the on-site analysis, and we need to understand which direction is the community facing and what geographic relationship does it have to neighboring facilities and venues. So our experience has shown that this practice is very important and very successful. So although there might be some cases emerging after the epidemiological surveys, in general, those cases are within our control. if we put in place very immediate epidemiological surveys and NAT, and we can very effectively contain the risk. Next question, please.
谢谢主持人。中新社记者提问，我的
I'm
问题
with
是基
China
于
News
上海卫生
Agency.
部的卫生主任。近期
My
我们
question
国
is
际
to Director General Mr. Wu from Shanghai Municipal Health Commission. Right now, we have 41 high-risk and medium-risk areas. And Shanghai is going to host the 4th International Import Exhibition. So what measures are you considering of putting in place? Thank you very much. So we need to focus simultaneously on economic development and epidemic control. What we feel very strongly is that we need to focus on prevention, and we need to stand on high alert against COVID-19. And secondly, we need to shoulder up the different responsibilities at different levels. For example, different jurisdictions, different enterprises, and different districts. My personal experience involving in epidemic control shows that when we are helping the locality to develop its economy while maintaining effective control against COVID-19, we have to always emphasize on 8 areas. Number 1, focus on key public places. Shanghai, as you know, is a mega city. We have 6 key sites. The first is ports or international airports. The second is amenities and hotels. And the third is public transportation. And the fourth key link is workplaces. The fifth link is key populations, and that's where we focus on schools and kindergartens. The sixth link is medical and health institutions. So when we are focusing on these 6 key links, we also need to prioritize on ports and medical institutions, hospitals, because they play a crucial role in keeping off imported cases. So when inbound travelers set their foot on Shanghai, they have to follow a designated route. They need to be transferred to a designated quarantine site, and they need to be subject to a closed-loop management. And we focus simultaneously on people, goods, as well as the environment. So that is why we have constantly optimized our COVID-19 prevention rules at the Shanghai International Airport. We have a task force at the airport, and our disease control personnel are fully engaged in this very important part of the work, and also on the transfer of cold chain food, on disinfection of those cargo trains and planes carrying the cold chain food, and also on those different facilities, and we focus on disinfection very strictly. And also we need to close the loopholes. I feel this very strongly in this process, no matter it is the Shanghai Municipal Party Committee and municipal government. We have constantly reflected upon our own actions. Whenever we encounter a problem, we would immediately rectify the issue. And based on the realities of Shanghai, we are a mega city, so that is why we have set up 2 task forces at the ports. And also, you need to put in place very strict management over high-risk groups of people. And this means those who work at hospitals, international airports, and the cold chain goods system. And these people, they have to be fully protected. They need to take regular nucleic acid test. They need to take the vaccines. And also, we can intensify the frequency of NAT for those groups of people. Shanghai is a city with a frequent flow of people, so that is why we always need to focus on the medium and high-risk areas, leveraging on the government service. We coordinate across different departments using the big data that we have collected about people's travel routes and history. We push the information to different departments, and this allows us to improve the quality of epidemiological surveys. For those who travel frequently between medium and high-risk areas, and their travel history can be traced, so this will enable very targeted measures of COVID-19 prevention. And also, we put in place very targeted measures. In case there is a new case identified, we will kick off our actions immediately. In Shanghai, we have accumulated a lot of very meaningful practices and experience. As I have mentioned, speed is very important. Effectiveness is also very important. And we also need to put in place very meticulous efforts, as I have mentioned earlier. So we conduct regular drills, and this is also very important because it can guarantee collaboration at the Shanghai Joint Prevention and Control Office. We work closely together with the Shanghai International Airports, with border control, with customs, with public security, and with communities. Up until this present day, we have been working together on a daily basis. So there is a high level of collaboration between different departments. And also, we have to focus on the vaccination campaign. In Shanghai, we have experienced several rounds of domestic infections, and my personal feeling is just as what Mr. Hua has mentioned, that vaccination is very effective in minimizing the number of cases of severe symptoms and hospitalizations, and it can also dramatically improve the immunity of the population. So going forward, we will continue to follow the requirement of the authority and do a better job in vaccination. Another very important piece of experience is we have to improve the dynamic analysis by experts, and they play a very important role because they can dramatically help us to improve the effectiveness of epidemiological surveys. So leveraging on the expertise of our scholars and experts, we can close the loopholes and we can improve our scientific policies, and we can carry out very effective controls. So going forward, we will continue focusing on these 8 areas. So due to time constraints, let's have 2 final question opportunities. Thank you very much. I'm with China Daily. Right now, the overall situation of COVID-19 is still very severe globally, and there are new variants emerging with the passage of time, and also we are entering autumn and winter, and this is making the COVID-19 control situation even challenging. So what are the measures you have in place going into late autumn and winter? Thank you for your question. Actually, we still face a arduous and challenging situation, and we are getting to the very last stages of autumn, and we are going to enter winter. So based on these risks, we have to make some early arrangements. We request different localities to carefully reflect on their vaccination programs, and they need to put in place sufficient number of personnel and working staff and provide effective support to the inoculation program. And we have already organized experts who formulated technical guidelines for the vaccination, and this covers influenza, COVID-19, and other infectious diseases. If in case the public need to take multiple doses of vaccines of different types, they need to follow the guideline formulated by the National Health Commission. According to the suggestions of experts, we do not suggest the public to take 2 doses at one time, and if you have to do so, you have to wait for 14 days. If there is a need to take the vaccines for influenza, the vaccine provider has to closely follow the guidelines of vaccination formulated by the National Health Commission, and they need to effectively communicate with the vaccine takers. And also we need to make some early arrangements on the production and supply of vaccines, be it COVID-19 vaccines or influenza or other infectious diseases. We need to bring innovation to our services, make sound arrangements in terms of timing, and also meet people's demand for vaccination. Last question, please. I'm with South China City News. So what is the experience of Shanghai in guarding against key sites in epidemic control? Thank you very much for your question. And as I have mentioned, we focus on some key links. And there are several very important guarding sites in this campaign against COVID-19. From the experience of Shanghai, we believe that at different stages, there are different key links. At the very beginning, you need to feature early reporting and early warning. At Shanghai, we have fever clinics, and we focus on staff training, and that is very important. And also, we need to standardize the operation of those sites and bring sufficient supply to those sites. And this can effectively improve the quality of the first-time treatment and diagnosis. And when we encounter a case, the case will be immediately identified, and it will sound the alarm, and it will activate the response system. And also, we need to fight against HAI, or hospital-affiliated infections. So that's why we believe that hospitals, they are the first responsible persons in this fight against COVID-19. So we need to put in place hierarchical diagnosis system, and this is very important. And also, for those who take in the patients, for those who administer the vaccines to patients, they need to take very good care of themselves as well. And also, we need to put in place very effective training for those who work at hospitals. And also at medical institutions, they need to regularly conduct a nucleic acid test. And based on the changing situation, sometimes the pace can be adjusted. And also, we need to put in place effective health monitoring for those doctors and medical staff. From the experience of Shanghai, after identifying an infected case, the case must be properly handled. In Shanghai, we have an experts pool. In Shanghai, once a new case is identified, and the patients will be addressed with a powerful pool of experts, and we featured the combined use of Western medicine and traditional Chinese medicine. So this can dramatically improve the efficiency and efficacy of treatments, and also amongst all the medical institutions, we emphasize on the backup capacity, both in terms of facilities and medical staff. And this is very important, and we reiterate the importance of this part of the efforts on many different occasions, because this can help us guard against potential risks going forward. All right, thank you to all the presenters. And in today's press release, we have introduced the situation of COVID-19 prevention and also vaccination, and we have shared with you some successful experiences in Shanghai for COVID-19 prevention. And we are going to enter the National Day holiday, and let me wish all of you a safe, healthy, and pleasant National Day holiday. And going forward, we will continue organizing press releases. And this is the end of today's press release. Thank you very much.